Are you tired of feeling sick and spending money on medical bills? It's time to learn how to protect your health and wealth by understanding gastroenteritis. Join us as we dive into the causes, symptoms, and the costs of this common ailment and discover how you can stay healthy and financially secure. Don't miss this important episode of Navigating Gastroenteritis for Health and Wealth Protection. Keep watching. A brand new episode of You and Your Money starts now.
You and Your Money is brought to you by Doctors Hospital Health System.
Welcome to You and Your Money, everyone. Joining us today to talk about navigating gastroenteritis for health and wealth protection is Dr. Beverton Moxey. Dr. Moxey is a board-certified internist and gastroenterologist who is also the Vice President of Clinical Services for Doctors Hospital Health System. He treats all diseases of gastrointestinal tract and is particularly passionate about colon cancer screening. Dr. Beverton Moxey, welcome to the show.
Thank you. Thank you for having me. It's great to be here with you today.
Dr. Moxey, I want us to start by unpacking what is gastroenteritis and what are its causes?
So gastroenteritis is a very common condition. Most commonly, people pick up gastroenteritis from infections related to viruses, bacteria, and even some parasites. Commonly, people get infected from food poisoning, and it could be salmonella or E. coli are the common culprits. And most often, we see patients as well with food poisoning as it relates to 𝗖𝗛𝗥𝗏𝗘, which we get from seafood. And so these are some of the common presentations, and I'm sure we'll delve more into what are some of the signs and symptoms, but those are the common factors or the common etiologies that we see in our health system on a weekly basis.
Now, how can you protect yourself from gastroenteritis?
Well, it's making sure that where you get your food from, that the food is prepared in a very hygienic way. Also, it's making sure that once you have food at home, that you store it properly, keeping it away from heat. Those elements oftentimes allow food to get infected by bacteria, and there are certain foods that are more easily prone to causing people to have some of those common ailments. Now, of course, if you live or if you work in an environment where, such as, or if you have children actually that attend schools, or if you're looking at nursing homes, and we have a few of them here, some of the more communal environments, these things can be easily spread. And oftentimes it's from either children playing together, which unfortunately, you know, it's very difficult to avoid, especially in the preschool environment where children are sharing toys, oftentimes maybe putting them in their mouths and touching certain things, and each one passing it from one to the other. And then also in those environments, sometimes when you talk about like the nursing home facilities, where you may have workers that are interacting with different patients, if they're not careful in terms of practicing good hand hygiene, that's also a very common environment where we can see outbreaks.
Now, one of the things you actually mentioned, you talked about keeping your food away from heat. Talk about that a little bit more with us. Okay.
So when you look at certain items, such as, like, I'll give an example, things that are mixed with mayonnaise, coleslaw. Okay. If you're purchasing food from a vendor, maybe even cookouts. You know, we have a lot of cookouts here locally in the Bahamas. And so if you are purchasing items, be very careful in terms of looking at how are the vendors actually storing those items. Are they being kept in a cool environment as best as possible, you know, that they're serving? And if you notice that there's something that is awry, you know, my advice is to certainly not purchase that particular item. Perhaps maybe you can support them in another way or with a different item.
All right, that's good information definitely for us to know about. What are some of the common ailments related to gastroenteritis?
Most often what we see is people are coming in with cramping abdominal pain, nausea, vomiting, diarrhea, And ultimately, they present themselves because their losses, they're losing so much either by vomiting or having the diarrhea that they've now become significantly dehydrated and weak. And so oftentimes patients present themselves when they're in a severe dehydrated state. And so they are no longer able to keep up with their losses, especially if they have nausea and vomiting. It's very difficult to keep something down. And so at that point, they're going to need to have some intravenous fluids. Oftentimes you can manage it right in the emergency department setting by giving them several liters of fluids, giving them antiemetics. Those are things that you would be familiar with, such as like Gravol, a very common one that you can provide over the counter, but it's giving in an IV form. And we have some other tools in our armamentarium that the common layperson may not be aware of in terms of trying to help to control the nausea. And so most often patients would settle after they would have had a round of medications in the emergency department, but then there are a few who, depending on how long they stayed out trying to manage it at home, they may require inpatient admission. And so we're able to make those decisions once we would have done the necessary or the initial interventions.
Are there any immediate home remedies that actually can be employed?
What I tell people often is that if you get a gastroenteritis and you have food poisoning, you want to take it slow. So just to kind of give an example of what happens. So for instance, when you eat food, imagine that food goes down your esophagus, which is the long tube that exits from the mouth, and then it drops, the food bolus drops into the actual stomach itself. Your stomach is where the process of digestion actually begins. You have acid pumps in that stomach that's helping to break down that food into a liquefied form, and then it goes into your small intestine, which is about 20 feet in length. The small intestine is like a carpet. It's an absorptive surface. It's responsible for absorbing all of the nutrients from the food that you eat. And once it's done that, at the end of the esophagus, it then moves into the colon, which then takes up all of the excess water. And so that colon, so by the time as everything presents itself, you would have already absorbed all of the water that you need to get out. And the body has its way of really making sure that it utilizes as much as it could. In somebody who has a gastroenteritis, the lining of the colon is inflamed and the lining of the small intestine is inflamed. Okay. And so what that means essentially is that everything is running through. So nothing is being absorbed in a significant way. And so you're losing the nutrients and you're losing the water, and that's why patients have the diarrhea, because the inflamed surface has lost its absorptive capacity. And so what I always tell patients is you want to focus mostly on trying to stay hydrated. So imagine if you are a sprinter, I'll use that example, we just came off of a very successful grifter. If you are a sprinter and you were to sprain your ankle, if I put you to go and run the 100 meters, it's going to certainly damage it even more. And so you want to take your time, you want to rest, you want to elevate it. And so the most important thing in that immediate period is really giving the bowel an opportunity to rest. If the bowel is doing all the work for digesting food and you're trying to still eat solid foods, salads, etc., meats, rice, you're actually making it work harder and you're actually making your symptoms worse. And so what I recommend is that the initial approach should always be to stay hydrated. Just keep drinking fluids, coconut water, tea if you could, apple juice. And then as your intestines recover, you can then add more solid stuff and perhaps maybe start with toast, and then you can work your way up until you're able to fully tolerate a meal.
All right, well, Dr. Moxey, we have to take a quick break, but when we come back, we'll be looking into the symptoms of this common ailment and what you can do to protect your health and your wealth. This is You and Your Money. We'll be right back.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From LAMP Prepaid with free prime care visits and service line discounts, LAMP Insured with copay waivers and zero upfront collections at the ER and inpatient services, or our new LAMP Access, a free plan that offers 10% off labs, pharmacy, and imaging. LAMP has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
The Central Bank of the Bahamas is pleased to invite you to attend the 2023 Financial Literacy and Digital Expo with over 30 plus financial industry providers. This year's Expo, Financial Literacy in the Digital Age, will focus on improving financial education, exposing attendees to the immersive digital platform, giving away $50,000 in sand dollars throughout the Expo. Join us April 28th and 29th from 10 a.m. to 5 p.m. at Fusion Superplex on Glasson Road. And remember, this event is open to the public and free to all.
Meet Leno, your bridge to the future. Wealth planning, investments, corporate services, trust services, pension administration, fund administration, outsourced accounting, and payroll. When you think of financial solutions, think of Leno. Local or international, company or individual, Leno can help. Our team of skilled professionals has the experience and expertise needed for you to strive. Your goals are our goals and our priority. Leno will guide you to the right financial solution with the knowledge, resources, and support you need. Give us a call at 242-396-3225 or email us at info@lenobahamas.com to get started. Visit our website, www.lenobahamas.com, for more information today. Leno, your bridge to the future.
Welcome back to You and Your Money. If you're just now tuning in, board-certified internist and gastroenterologist, who is also the Vice President of Clinical Services for Doctors Hospital Health System, Dr. Beverton Moxey, is talking to us about gastroenteritis. Dr. Moxey, before the break, we talked about the causes of gastroenteritis. What are some of the common symptoms and how can they be treated?
When we look at some of the common symptoms, we are mostly seeing patients present with significant dehydration. We're seeing them present with abdominal pain, typically described as cramping, and that cramping occurs because the intestines is essentially feeling as if it has to work very hard, and so you have that cramping pain. They also present with nausea, vomiting, and diarrhea, and sometimes fever, temperatures, high temperatures.
What are some of the long-term health consequences of gastroenteritis?
Well, patients can develop what we call a post-infectious irritable bowel syndrome following a bout of gastroenteritis, and this is essentially where they continue to have abdominal pain. They may notice that their bowel movements are not back to their original form state, and that may take a while. And oftentimes it could be because the bacteria that's inherent or that kind of lives, it's been disturbed in your usual environment, and we would often prescribe probiotics to help to bring that balance back.
And is there anything in particular with how individuals can help to protect themselves and their families from gastroenteritis?
I think proper hygiene, hand hygiene, is critical. It's key to making sure that you protect your loved ones, and that's in meal preparation, as well as if you know that there's someone that is sick in the home, or if there's someone that's sick in your environment, whether it's at work or at school, being very careful as you interact and making sure that you wash and you sanitize your hands appropriately. The other thing that I would advise persons to do is to make sure as you prepare meals, you're also keeping that hygienic environment, clean surfaces, clean cutting boards, making sure that as you select your particular meats or seafood from your vendors that you purchase from, that you feel comfortable with the setting and the way that they keep and store their products. And so it really just requires an overall vigilance on behalf of of the general public.
One of the things that comes to mind as you're talking about it is, my daughter says to me about, she's in food nutrition and is talking about cross-contamination. So it seems as though we definitely have to make a conscious effort to make sure that we're not cross-contaminating when we're in the kitchen. Absolutely,
that is absolute. And also, as you visit vendors, we often go to, some of the common locales, the local spots. I guess I should probably let them remain nameless, but you go and you partake and you get your nice conch salads, and we know that we've had some outbreaks over the years, and so you just want to make sure that people are doing what they need to do to prepare food in a safe way. And I think that the Ministry of Health has done an excellent job from time in terms of making sure that persons who are actually handling food, that they do the food handlers courses. And so that's always a good initiative and to keep on top of. And of course, as we would have mentioned earlier, when we look at having our cookouts, which we have quite often. And so people just doing the food handlers courses and making sure, I think as long as people do what they were taught, we'll be in a good place.
Yeah, I think that definitely leads us well into the next question, which is, what impact does gastroenteritis have on the wider community?
Well, you can have significant outbreaks, and we've seen instances where the healthcare system has become burdened or overrun, where you have, especially if you have large outbreaks of infections from particular places, and you have a lot of people presenting in the healthcare system, in the emergency departments, at our local hospitals, in need of having IV fluid rehydration, in need of having IV antibiotics and other medications to help to support and get them better. And so this becomes a challenge, because all of the other diseases, unfortunately, don't just fall off the earth. And so, we're dealing with the usual emergencies, people coming in with issues, cardiovascular issues, other strokes, pneumonias, et cetera. And so when you have these outbreaks that affect large portions of the population, it definitely puts a burden on the healthcare system at that point in time.
Do you find that gastroenteritis actually happens for particular age groups, or it's not age specific?
It's not really age specific. It just depends on what's actually causing it. So when we see the viral gastroenteritis, that tends to affect most commonly children in school environments. They're in close contact, they're playing with each other, they're sharing toys, sharing different devices. And so it is a very good breeding ground in terms of being able to spread the viral pathogens. When you look at adults, it's usually, if somebody's been food poisoning by bacterial infection, it's usually a particular, once we trace it back, there's some particular inciting event. It could either have been maybe everyone was at a party that may have was catered, and there was something that happened. There was an outbreak at some of the popular local spots. And so you see it in clusters. And so it just depends, on how many people were actually at that venue at the time. That would really determine, how much of a significant burden it would bring, upon us and the health system at that time.
Okay. Well, Dr. Moxey, we have to take another break. This is You and Your Money. We'll be right back.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now.
Go to doctors.
3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Meet Leno, your bridge to the future. Wealth planning, investments, corporate services, trust services, pension administration, fund administration, outsourced accounting, and payroll. When you think of financial solutions, think of Leno. Local or international, company or individual, Leno can help. Our team of skilled professionals has the experience and expertise needed for you to strive. Your goals are our goals and our priority. Leno will guide you to the right financial solution with the knowledge, resources, and support you need. Give us a call at 242-396-3225 or email us at info@lenobahamas.com to get started. Visit our website, www.lenobahamas.com, for more information today. Leno, your bridge to the future.
The Central Bank of the Bahamas is pleased to invite you to attend the 2023 Financial Literacy and Digital Expo with over 30 plus financial industry providers. This year's Expo, Financial Literacy in the Digital Age, will focus on improving financial education, exposing attendees to the immersive digital platform, giving away $50,000 in sand dollars throughout the Expo. Join us April 28th and 29th from 10 a.m. to 5 p.m. at Fusion Superplex on Glasson Road. And remember, this event is open to the public and free to all.
Welcome back to You and Your Money. Dr. Beverton Moxey, Vice President of Clinical Services for Doctors Hospital System, is still with us. In the previous segments, we spoke about the causes and the symptoms of gastroenteritis. In this particular segment, I want us to shift our focus to look a bit closer at the cost factors. So, Dr. Moxey, how much does gastroenteritis cost individuals and families?
It can be pretty expensive, especially if you're looking at someone that needs to present themselves to a hospital environment and ultimately require admission to the hospital. And so it can be, you know, if the individual can actually hydrate themselves at home and maybe take some over-the-counter medications, that cost may be limited, but it depends on the family and what their resources are. If you're looking at having either a child or an adult that now has become so dehydrated or so significantly impacted by that infection, and they have to either seek care at their physician's office or at one of the local clinics or the emergency department, the cost can escalate to the thousands in terms of trying to help to get that person back to their optimal health.
Now, what are some of those ways to prevent the financial impact of gastroenteritis?
Well, it goes back to practicing great hand hygiene. Everything goes back to hand hygiene. And hand hygiene has become, I think, a topic that just even persons outside of healthcare have become acutely aware of, just, you know, with the world just coming off of the heels of the pandemic. And so people understand that it is important to make sure that you sanitize. And so you would often see people, everywhere you go now, you're seeing sanitized stations at many establishments, even outside of healthcare. When I go to church and we have communion, it's required. You're sanitized even before you go up for communion. And so I think that the education, I think that the awareness of the importance of great hand hygiene has been heightened after coming off of the COVID-19 pandemic. And so this is an excellent way for us to continue to reinforce that. And I believe that a lot of infections can be prevented by ensuring that we practice good hand hygiene. And the good thing about it is that it is something that has actually been even instilled in children. They are also acutely aware of the importance of hand hygiene and sanitizing.
How does the financial impact of gastroenteritis differ based on age and socioeconomic status?
It all boils down to resources. It boils down to, as you know, there are some persons who are uninsured. And so they do not have the capacity oftentimes to present themselves to private physicians or maybe to private institutions. And so but I will say that healthcare is not denied to them, because there are a variety of clinics that we have throughout the islands, a variety of clinics that we have throughout New Providence, and we also have Princess Margaret Hospital. And even within our own healthcare system at Doctors Hospital, our goal and our role, I think we are good corporate citizens at Doctors Hospital. Somebody presents to the hospital, they are in a very critical state. Our mission is to actually treat and stabilize. And so we do that despite a patient even having the financial wherewithal. And once they're stabilized, then we make some decisions in terms of what is the best place for that patient to go. But the role is to make sure always take care of patients first.
It's good to know that you know, it's the focus in terms of having to stabilize the patient. How does the cost of gastroenteritis compare to other common illnesses?
I would say that's a very good question. And unfortunately, I don't think I have the statistics on that to say that, you know, looking at what gastroenteritis would cost compared to, say, if somebody presented themselves with a pneumonia or with a stroke. But I would venture to say that when you look at some of the other things that we see patients for commonly, such as uncontrolled diabetes, strokes, and heart disease, those particular disease entities really require a lot of different diagnostics that can increase the cost of that healthcare service. And so I would say that when you look at it, the cost factor would certainly be more for those, but to give you a number, I think that would be very difficult for me to do at this time.
Well, while we're still talking about some of the cost factors, what are some of those long-term financial implications of gastroenteritis?
I think most of the implications financial-wise are short-term, in the sense that gastroenteritis is a condition that once you've identified what's actually causing, what's the inciting agent, and you've treated that patient, they recover fully at 100%. There may be some persons that go on to develop a post-infectious irritable bowel syndrome. However, that could be maybe weeks to months, but that in and of itself also resolves. When we look at patients that may present with some of the other chronic non-communicable diseases, such as uncontrolled hypertension, uncontrolled diabetes, these are things that have implications for affecting other organ systems that can now increase disease burden and cost. Most commonly, the renal system, kidney system, people developing renal failure. And once someone develops that, they become dependent on renal replacement therapy, and that's usually a long-term thing unless they would have received a transplant so that they no longer require the dialysis services. So those things would have more of a long-term financial impact as opposed to a gastroenteritis infection.
All right. Well, Dr. Moxey, I do say that, you know, today's show has been very informative, talking about, you know, the causes, the symptoms, as well as some of the cost factors that's involved with gastroenteritis. Thank you so much for coming on the show today.
You're welcome. It was my pleasure.
Well, that's it for today's show. We want to give a special thanks to Doctors Hospital for sponsoring today's show. To get in touch with them, you can contact them using their main line, which is 302-4600, or visit their website at doctorshosp.com. Don't forget to follow You and Your Money on Facebook and tune in next week for a brand new episode. I'm Ria Christina. Thanks for watching, and I'll see you next time.
You and Your Money was brought to you by Doctors Hospital Health System.